This is a special video made per duckapuss's request. She wanted me to make a video for everyone, just to let her know, let you all know how she's doing and everything. Basically, the reason she hasn't been able to be online lately, not just to not post videos, just be online, is because she's been in the hospital. I'm not sure really how to explain it that'll make sense, but she had her final chemo 2 weeks ago, this Thursday, June 7th, 2 weeks ago, and it went okay. I was up there 2 weekends ago, and once that Monday hit, when I was there, which was Memorial Day down here in the States, she had her normal soreness and back pain and whatnot, and that's common from the medicine that she was on. But as the week went on, it gradually got worse, which it usually does, until this past Sunday, which was always the worst day. But for her, the worst day came earlier. I got a call on Saturday afternoon saying that in text messaging late Friday night, saying that she was being admitted to the hospital because of the fever and back pain and chest pain and just overall feeling really horrible and feeling sick. So basically, her neutrophil levels, which I believe are part of your white blood cells, her count was really low. I think they say 0.2 is like low, and hers were 0.1, which was almost, which is pretty critical. Also, her portacath, which I'm not sure if any of you know anything about that, but it was put in, and a line goes up to her neck and into one of her main veins or arteries, and it would just it made ease so you wouldn't have to put IVs in your veins in her arms anymore, because they would get bruised up from all the IVs she would get. But basically, that got infected one time before. They thought they got it all, but obviously they must not have, or it came back this time very severe. She said that she had what you called a staph infection, which was, I think, over her whole body. But since this was all on Saturday, they started her on antibiotics and everything, and to start feeling better, which is what they did last time. They also gave her different kind of, I'm not sure what CAT scan, and I'm not sure what all the kind of scan tests they gave her, but it found out that she had a pulmonary embolism in one of her veins in her lungs, which is bad, like very bad. Then if it wouldn't have got treated along with her infection, she probably could have died. And those were her words saying that to me, which is not the greatest thing to hear, but since Saturday, since Sunday, throughout the week, I've talked to her throughout the day a couple times on the phone and whatnot, and talked to her parents, and they kind of filled me in when she was sleeping or when she was away getting other tests. But the infection has gone down a lot. I can't say that it's gone yet because I don't know. Her blood counts and have went up. Her heart rate has came back to normal. Her blood pressure is somewhat back to normal. Normal being normal for chemo people, not like I'm not the healthiest person in the world, but I'd say my levels or whatnot were normal. The reason her infections, even if it's a minor infection, like you and me can get a minor infection from a cut or from whatever, we can fight it pretty easily, and we won't even know we had an infection just because our immune system is that built up. But when you have chemo, your white blood cells, which I believe are the ones that fight infection, they get worn down because they're actually trying to fight the chemo, which is trying to fight you, which is so it's all mixed into one. So, but she's getting better. She had a fever a couple days here and there, but that has went down, then it comes back, so that's still fluctuating, which is being monitored. She's in good hands. The doctors and nurses have been there, a couple times a day. The nurses have to, give her things and check up on her and everything. She had lots of visitors, a few friends from up there, her parents, brothers and sisters, her brothers have come to visit her, so that has helped, but she's still in bed. I won't get into too many details, like, about, different IVs and this and that, but, basically, she's still in the hospital. They were slated to maybe release her tomorrow. This was on Monday. But this embolism she has is still giving her very bad chest pains. It's hard for her to breathe. Take a deep breath, Imagine doing that and not being able to do that, and it hurts very much. Because that's what it is to her, and which in turn makes her whole body hurt. They are giving her medicine. She's on IV. She is getting better. It's just this issue with this embolism. That's like the main cause. Right? That's the main issue right now. Everything else is somewhat, is rising and going, and the infection's going away. Her counts are coming back to normal. It's just this embolism, which was caused from, you don't know. I think those things can form, any time, or what basically is. I think it's a type of blood clot in your vein or your artery, but like it sticks to it, and it closes the passageway of that specific vein of blood to go through. I think that's what they are. She's been given blood thinners and whatnot to try to not so much break it up, but to keep her blood thin so it doesn't clot up all the way, because that could be really bad in your lungs or in your heart, and those are the two worst places to get them, because they can, you have hundreds and thousands of veins everywhere. Having one of them blocked up screws everything up. So that's where we stand now, which now it's Thursday, about 11:30 at night. It's Wednesday, about 11:30 at night. They're still hoping for her to come home on Friday, but depending on how her embolism is being handled as far as it recovering, which what the doctors are hoping it just absorbs itself back into her body, which normally that's what some of them do. If not, I don't know how long they will keep her or what else can really be done. But she just wanted to let you all know, this is, wanted me to tell you that's pretty much what has been going on with her. She appreciates all your support, and she will be back. Maybe not for another couple days or a couple weeks or whatnot, but she will be back, and it's just a really rough time for her right now, as I'm sure some of you can imagine, others can't. But it sucks, basically, to put it bluntly. Cancer sucks, but she wanted me to assure you that she will be okay, and that she will return at some point. I can't promise when. I don't think she knows when. But if she wants me to make another update video for her, I definitely will. And we can go from there. She appreciates everyone's nice comments you give and checking up on her. They're all appreciated. So basically that's about it. If you have any questions, just leave a comment under her name, or leave me a comment on my page, and I will try to answer the question as best I can, to my knowledge, or to what she would want to be released. But she will be okay. She's recovering. She'll just have to be in the hospital for a few more days. Alright, thanks for your time, everyone. I will let Ducky know next time I talk to her, which will be in the morning, that I posted this for her, and to let her know that she's getting a lot of support from you guys, and it does help. So thank you, and good night.